Hi, I'm Dr. Stuart Cox.
And I'm Dr. Jared Norman, and we're with Nevada Spine and Disc. We'd like to give you a chiropractic tip. One question I get asked all the time is, what's a good stretch for my low back? Now that's a really good question, and what I've found is that there's really two muscles that can create a lot of low back pain, and that's your glute muscles and your piriformis muscle. The piriformis muscle is just below the glute muscle, so I'm going to show you two different ways to stretch these two muscles. So the first way is, and it's actually the most effective way, is to lay down on your back. You can do this, most commonly is done on your bed. You're going to lay down, you're going to grab one knee, and you're going to pull it up to your chest. And as you stretch this muscle, as you do this, you'll feel it stretching right here in the middle of your glute muscle. And then you're going to hold that for about 20 seconds. Then what you're going to do is you're going to pull that knee across your body to the other side. And that's where you're going to feel it more on the side here. And that's stretching your piriformis muscle. And you're going to hold that for 20 seconds. And you're going to do that on both sides. That's actually the best way to stretch these muscles. But you're not always close to a bed or a place that you can lay down and do this stretch. So if you're at work and you're getting that tight low back, you can also do it in your chair. You're just going to cross your leg like this. Then you're going to pull that knee. Once again, you're going to pull it up to your chest like this. Okay? And that, once again, is going to stretch these butt muscles, the glute and the piriformis. And then another way is you just sit upright like this with your leg crossed. Keep your back nice and straight, and then you're just going to lean forward. Okay? And that's going to stretch that same area, your glute muscles, your piriformis muscle, and that's really going to loosen up that low back and really help you to manage that low back pain that you're dealing with. One of the biggest objections that I've heard of people actually going to a chiropractor is that they've heard that the adjustments can be painful or very uncomfortable. If that's a concern or an objection that you have, then I would recommend finding a chiropractor that utilizes a computerized form of adjusting called the Pro Adjuster. Now, the Pro Adjuster is a computerized form of adjusting which is very comfortable and very safe. And all of our patients that we have that utilize this treatment, they love it, and they actually prefer this type of treatment over the other manual treatments. There are many benefits in being treated with the Pro Adjuster. One is that there is no pain or discomfort with the treatment. Two is that you can actually get the same amazing results as you would get with the traditional chiropractic, but once again without that pain or discomfort. And number three is that you can actually see on the computer screen a scan of how the spine is moving before the treatment, and then once again after the treatment. And with that scan, you will be able to see if the treatment that you have received has been effective in the treatment of your neck or low back pain.
If you're experiencing symptoms of neck pain with radiating pain down into the arms or hands, numbness and tingling as well, if you're having those types of symptoms in your lower back where you are experiencing pain into the buttock area, leg, foot, these symptoms relate to a condition that has to do with the herniation or possibly bulging discs. I've had patients ask me, are there any alternatives to surgery for having this problem resolved? And the answer to that is yes, there are. The table that I'm sitting on is a spine med table, which is a non-surgical spinal decompression, which takes the disc, the herniated disc or bulging disc, and retracts that material, taking it off of the nerve and back into the disc. If you're interested in a resolution for your problem with disc herniations, disc bulges that are causing this type of pain, numbness, and tingling, I would recommend that you find someone who has the spine med table, as it is the most advanced technology that's out there today. If you've liked what you've heard and you'd like to know more, visit us at stopthebackpainnow.com.